there's a shortage in the field. All of her imaging modalities have a shortage. And they actually, one of her pulling points is what she's doing is she is currently offering programs like mine for them to advance. So she was like, if you come to work for us, we will pay for you to get educated and learn these different modalities. And so, of course, that's helping the technologists, but it's also helping the institution.
Welcome to Frame by Frame, Rethink Imaging, a podcast by Imalogics. Here, we explore the intricate world of medical imaging, aiming to dissect the field and inspire both professionals and curious minds alike. I'm your host, Chris St. John. Welcome back to Rethink Imaging. I'm your host, Chris St. John. Today, I am super excited. Our guest today is Chalonda Jones-Thomas, an educator, radiologic technologist, and the founder of the Thomas Institute of Health Professions. She has over 2 decades of experience in CT and MRI. She has trained thousands of technologists across the country, and Chalonda helped create the first fully online CT training program, which, reshaped how advanced imaging education is delivered. She is a national voice for access, equity, and innovation in healthcare training, and we are super excited to talk to her today about closing the technologist gap, building smarter curriculums, and empowering the next generation of imaging professionals. Chalonda, thank you so much for being here today.
Thank you for having me, Chris.
I'm super excited. So let's just get right into it. So you've been called a pioneering radiologic technologist who has broken barriers down, especially in an extremely male-dominated field. So tell me, what pulled you into imaging in the first place, and how did your early years kind of start to shape how you ended up in education?
Well, a life-changing story. So I originally went to college to be a social worker. And do you know how when you're in high school, you take these career tests?
Oh, yeah, of course.
Assessment tests to tell you what you're going to be when you grow up? Well, it was
Right.
strongly likely I was going to be a social worker. So I graduated from high school, and then I enrolled into a community college to be a social worker. While I was going through my social sciences, I had to take biology and anatomy and physiology. And so it was my anatomy and physiology teacher, biology teacher, who told me about the field. So one night, I was taking night classes. One night he said, Chalonda, what are you going to school for? What's your major? And I said, to be a social worker. He like, no. He like, you're too good. He said, you're too good in the class to be a social worker. I'm not knocking social workers, but you should look into the medical field.
Mm-hmm.
I asked him, what do you think I should look into? And he said, one of them you might like is radiology. And he said, to be a radiologic technologist. He suggested that I go to actually go to the hospital and look into it some more. So I went and shadowed. I was amazed at how awesome of a field radiology was. And I actually was surprised. I had never heard of it, right? So I quickly came back and changed my major from being a social worker to being a radiologic technologist. So that was my shift in thinking at that time. Also, as far as being an educator, it was that instructor that planted in my head that it would be an awesome career educating others. So fast forward, I did go into the field of radiology, and I loved it from the start. And so that's how I got into the education side and also to be a radiologic technologist.
I love when there are good educators out there who engage with the people that they are teaching on that level. It shows the windfall results of that teacher having that conversation with you, just like, hey, you may not be doing exactly what you want to do. And then, spoiler alert, later on you go on to found a fully online tech training program. But that's a serious windfall from just an offhanded conversation.
Yes.
And so you were at UAB for over 15 years, starting as a technologist, and eventually, you worked your way up to
Yeah.
assistant professor. Were
hmm
there any like moments in that time that really like pushed the education side forward for you?
Yeah, so I've always had a passion for sharing my knowledge. Even when I was working on the floor as a technologist, students would naturally gravitate towards me. I later found out that my name was used a lot in the classroom. So a lot of times when they would ask a question, the student would say, "Oh, Miss Chalonda told me that." And so after about 2 years working on the floor as a supervisor and being a clinical instructor, they contacted me and asked me would I be interested in becoming the full-time clinical instructor for the UAB radiography program. And so, of course, I accepted it because I love, again, teaching. So at that time, I was between the hospital and also the college. So I taught the college and I taught at the hospital. And so this dual role helped me to teach better, actually. I was able to see that unique perspective of the students. I could see how the students were thinking in real time, where they were struggling, and how there was a disconnect actually between the textbook and the real world practice. So technology was advancing very fast at this time, and the textbooks was actually lagging behind. And
Hmm.
so this helped me to transform the way we was teaching our students. And that's when I knew education was where I would really push things forward.
Yeah. And so then, in 2009,
hmm
you kind of helped start the first fully online CT Tech training program. Where did that idea come from? Who were you working with? And what did the genesis of putting that first program together look like?
So in 2009, the idea actually came directly from what we were seeing in the field of medical imaging.
Hmm.
So at this time, medical imaging was merging, like the technologies or the different fields were merging together. For example, PET CT.
Hmm.
So, and education hadn't caught up, like I said, at this time. So I was hired through UAB Nuclear Medicine program as an assistant professor and a clinical director. And not only developed the first CT, totally online CT program at that time, I also developed the first MRI program. So I did both of them in conjunction, got them both approved through the state. And so there was not at that time any other program like this. At best, we had a lot of hybrid programs, but not a totally fully online program. And so this is how we moved forward, and it was actually accepted, widely accepted after talking to a lot of the technologists and the radiologists.
Hmm. Were you driving that program on your own? Like, or did you have a team that you were working with?
Actually, I was driving it on my own.
Hell yeah.
So
Crazy.
I was driving it on my own. I was the only, at the time, I was the only technologist and educator that was triple certified. So I'm certified as a radiologic technologist. I'm certified as a CT technologist, and I'm also certified as an MRI technologist. So I was contacted by the director at the time and asked would I be interested in working for the nuclear medicine program. I was previously working for the radiography program. And I also have dibbled a little in nuclear medicine. So he thought it'll be a great fit to push the program forward. Also, I have had a lot of I have a good relationship with the doctors out there, the radiologists. And so he was asking me would I, go and talk to the radiologists, explain the program to them, what the benefits were of the program, etc. So that's how we got it up and going and started. And I was teaching both of those classes at the time. One woman show.
So you're getting this program up and running. What roadblocks were there roadblocks that you hit both in terms of like designing the program, convincing people it could work, and like To me, there seems to be like some level of disconnect, right, in like the
Hmm.
tactile nature of
Hmm.
scanning someone on a CT. So like,
Hmm.
how did you think about overcoming these challenges, but specifically like the physicality of it?
Oh, okay. So honestly, I had very few roadblocks because of the relationship that I have built over the years. I had a strong, again, relationship with the radiologists and the clinical staff, not just at UAB, but across different clinical sites. Because at that time, before I became the assistant professor for nuclear medicine, I was also the clinical director. So I would go out to different clinical sites. And so they knew me very well and they knew the quality of students that was out there. And so I didn't have a lot of pushback from it. Once I explained the course design, how we had built-in assessments, because that was a lot of questions about that. How would you assess the students? How you know the students was not going to be cheating online, that kind of thing. After I
Hmm.
explained how we was going to do that, the use of videos, we had simulation software, not as good as today though. And we had checkpoints before the students ever touched a patient. So most of the directors and radiologists were on board. Also, I emphasized to them the benefit it will be to the clinical setting, especially with patient care and especially with our fields merging together. So it was more beneficial to have a multimodality technologist where we had PET CT, so they knew about nuclear medicine, they knew about CT. And so they were on board with it.
Yeah. And so you've said before that nothing makes you happier than watching your technologists, hit their career goals. I'm curious about like access and how your online program opened doors for folks who, may not have had access to this type of education before, like either adults who are already working other jobs, people in underserved communities. I'm just curious, like in terms of like what you've seen in terms of access.
As term of access, I have this saying that online does not mean offhand or hands
Hmm.
off. So I've had that saying and I have that mentality about online because I have seen some not great online educational programs. And so I actually learned from those that was not that great because again, we were not just putting lectures online. We was actually putting forth a lot of effort to make sure that the students, when they went out to clinic, that they understood the clinical site, how it operated, etc. So we would take videos, we'll go out to clinic, we'll video the equipment, let them see how it was, we did simulations, etc. So now, as the CEO and the founder of the Thomas Institute of Health Professions, I am proud to say that we have maintained a 100% pass rate, and we have been in business for over 10 years now. And so I
Congratulations.
love the fact that I'm able to make a difference not only in the technologist's life, but also in the life of our patients. And so we have anywhere in our program, we have healthcare professionals or working adults that are parents, secondhand career professionals, and technologists in rural and underserved areas who otherwise could not have access to advanced imaging education. Because as you know, when you're talking about rural areas, you have to travel a lot of time to even get your education. And so many of our students at the Thomas Institute of Health Professions are already working full time. So online flexibility allows them to upskill without putting their lives on hold. And so that is like the power of online and how online can push forward against boundaries, push through boundaries. So again, with online education, it allows you to reach areas that could not have been reached before. And so I've also have military students that's not in the country. And so that's a unique population where you have military students that they know once they leave the military that they need something to fall back on. And so they're able to image in the military. So they have a desire to get their certification. So when they become civilians, that they are able to enter the workforce. So that's another benefit that online education and the Thomas Institute Health Professions have when we talk about online education.
Huh, that's interesting. I didn't even consider the military angle. Y'all don't do anything with like the VA or anything, right? You're mostly just like training active military members?
Well, we have students from all over,
Right. Yeah.
so that includes the VA as well. And we talk about the rural area. There are several medical institutions that have partnered with us to get their technologists trained. And so we do webinars, and a lot of times I do like group webinars where we train them a lot of time at the job. There are other institutions allow us to do it on the weekends, so they're at their home or wherever they can be to get that information. Again, because as you know, if you have a technologist that is well skilled, then that increases patient care. And so that decreases a lot of liability on that
Hmm.
institution as well.
Yeah. So I mean, I know we touched on it briefly, right? You said that online education is not offhand education, but I'm curious just what your framework and thinking is in terms of building a curriculum, especially for adult learners in a virtual space, right? Do you have like any like key talking points about your approach and how how you can keep it challenging and online, but still have like this human element running through it?
So adult learners bring experience. We know that.
Right.
So they have previous experience. They also have accountability in the real world context, but they also bring responsibilities. My approach is structured, rigorous, and human. I designed the curriculum that respects their time while again being challenging. And I allow them to think critically about what they are studying. Clear expectations is given up front. We give feedback throughout. So again, we don't just put the information out there and leave them on their own.
Mhm.
We give them feedback throughout, and they have real world applications. And so that is key when you're talking about adult learners. They want the rigor. They want to make sure they understand what they need to do and how to perform the procedures. So again, we provide that. And I believe wholeheartedly that when you have a program that is very rigorous, make the student accountable for their actions, make sure they understand the material. And I've had students to tell me that is kind of unique with my program compared to some other programs that they have attended. A lot of times I have students that come to my program after they have attended another program and didn't do so well on the registry. And so a lot of times they tell me that, oh, I didn't know that. Oh, now that makes sense. Because I always try to merge not only what they're learning in the book, but what is happening out there in the real world so they can actually see what's going on. And we also have students that is doing their clinicals at the same time. And so a lot of time that light bulb, cut on, like, oh, that's why that do that, or that's why that is the way it is. So
Mhm.
that is how that's my thought process in curriculum and developing the designing and of the curriculum is to make sure that the students understand the information and can apply the information.
Yeah. Would you mind just touching a little bit more too on what the transition from like the digital learning space to actual like, clinical practice walking into the scanning room, right? I'm curious about like what the transition from one to the other looks like.
So as far as the digital learning part of it, we go over protocols, procedures. Again, we have videos where they can see it. They actually have the opportunity to do live where they can talk to me, bounce things off
Mhm.
with me. We have guest speakers to come and talk to them as well. I implement a lot of videos, not only from other healthcare professionals, but I also have videos from my own YouTube channel that we implement into the classroom. So I always find it easy for students to learn through analogies so they can relate. And so students tell me that, oh, okay, now that makes sense. And so just using analogies also help them as well. And so when they get out in clinic, they, like I said, they've already seen the machine. They kind of have an idea how the machine works. We have some simulations inside of the classroom. So they're not physically touching the patient. So if they make a mistake and they don't have, it's not as stressful, because if they make a mistake, they can go back and say, oh, this is where I made the mistake at, and they can correct it. So that gives them more confidence when they go out into the clinical space.
Yeah, I wanna shift gears like a tiny bit,
Mm.
still on the same track, but starting to talk more about like the workforce issues in general. And so I didn't send you this question ahead of time. Apologies for that. But I recently did an interview with a gentleman named Jeffrey Roche from a like education technology consulting company called RisePoint. But
Yeah.
one of the statistics Jeffrey shared with me is that there is an active waiting list of about 20,000 students just like waiting to get into a radiological technologist education program right now. And I'm curious about your program specifically, and like, are you operating at capacity? Is there are online programs a viable route for these folks who are sitting on waiting lists and may not know that there are other opportunities that they may not have to sit around and wait for?
Yeah, so my program is actually geared more towards medical imaging professionals. So we do not accept entry-level technologists yet. So we actually are in the middle of developing a curriculum for MRI assistants. So
Yeah.
that
Jeffrey was talking about this too.
yeah, so for MRI assistants. So that program is coming out very soon. So we have developed that program, waiting to get the approval from the ARRT. And so that will be actually a gateway for entry level students. They will get a chance to go out there in the field, see what the field is about. And of course, if they're a good worker, especially like in MRI, if they're a good worker, the chances that a lot of companies will invest in them and their education is very high. I recently talked to one of the partners. She's an executive director, and she was talking to me. She like, there's a shortage in the field, and she like, all of her imaging modalities have a shortage. And
Oh
they
yeah.
actually, one of her pulling points is what she's doing is she is currently offering programs like mine for them to advance. So she was like, if you come to work for us, we will pay for you to get educated and learn these different modalities. And so, of course, that's helping the technologists, but it's also helping the institution in making sure that the patient is getting the patient care that they need. So as
Yeah.
far as there being a shortage as far as entry level and the facilities running at full capacity, that has always been a problem, actually. And so I know that there are, here in Arizona itself, we have 4 to 5 programs, and they're always full. So, and there's a long waiting list. So that is true. But yeah, our program does not address the entry level.
Yeah. I mean, I believe that CT tech vacancy rates hit like 19.5% last year, more or less. Don't hold me to that number.
Yeah.
But roughly, it was 19.4% in 2025.
Yeah.
Like, what do you think the most practical moves are that we as a community can start to make to start addressing that issue? And like, where do education and upskilling programs like yours kind of fit into that?
So again, by it being online and reaching a wider audience, I think that more and more technologists are becoming very familiar with, especially because I feel they're becoming very familiar with online learning, and they prefer online learning because of their current positions and their workload. Because when we talk about the shortage and the workload continuously increase. And so it makes it more challenging for technologists to advance and to upskill. So I when I look at it, I see that a program like mine is helping close the gap. And I actively have seen that because the my program have grown a lot and it's very popular. And again, I've had students to tell me that they have chose this route because there was no other way. They couldn't physically go into a classroom and sit down in a classroom due to their workload and their schedule.
Hmm.
Myself have experienced that firsthand. So when I was working on the floor, I wanted to go back to school and I tried to find ways to go back to school. At the time, online was kind of new. And so I was talking to an executive and I was asking a question like, where did you go? And she told me she went online and did it online. So then that's when I started looking online and I got involved with the University of Phoenix and went to school there. It was a very rigorous program, but I made it through there. But it was my typical day would be come in, drop my stuff I had in my hand, pull out my uniforms, cooked. As I cooked, took out my computer, start working, writing papers, and I'll
Hmm.
in between do homework with the children. And that was like my whole routine. Go sleep most time, 3 o'clock, 4 o'clock, get up at 7, because I had to be at work at 8. So it was kind of
Hmm.
like that juggle. But
Right.
at the end of the day, it helped to close the gap. And so I think that is the important part of having a program like this. That was my reasoning for having or found being the founder of the Thomas Institute of Health Professions, because I myself knew the struggle that healthcare professionals have in advancing in their career and they can feel stuck. So
Hmm.
that helps them to feel unstuck, like they have
Yeah.
ownership of their life and they can do it and they can juggle both. So I always be transparent with my students and let them know you can do it because I had 4 children at the time. And
Whew.
whew, yeah, I'm telling you. So I had 4 children juggling all of this and a husband. So yes, but again, although there was a struggle, I felt fulfilled. And it
Hmm.
opened the gateway for me to again advance a lot quicker in my profession. Because I had a lot of students like I had a lot of time I had students like, how did you get from this point to that point? And for a long time, not anymore, but for a long time I was known as the youngest to be in different positions. So I was like
Hmm.
very young when I became the active supervisor on the floor. I had just graduated like 6 months because I actually turned them down at first. I'm like, not
Wow.
me. I'm not ready for this. And but my level of because I was going back to school, and so the level of education I had, and I also worked there as a student technologist. So it helped, for them to see my worth. And also the
Hmm.
radiologist was like requesting me to do certain procedures. So I did. Actually, my coworkers encouraged me to take the position. And so I'm glad I did. And again, just I know the power of education and to close that gap for other people is very passionate for me, because I feel like everyone should have an opportunity that wants it to learn and to advance and to move forward.
Yeah. And I mean, honestly, I feel like your model is also helping close like diversity gaps in imaging, right?
Yes.
Like
Mhm.
I feel like having these online programs is providing a level of access, especially for folks from like underrepresented backgrounds
Mhm.
in this community, right?
Yes. When you said that, I thought about one of my students. She is from a under
Underserved community.
yeah, community. And so she contacted me because she was actually discouraged. And so she said that her manager told her that she don't think that it's needed for her to get her CT certification. I don't have a CT certification. So why are you trying to get one? And so she was like, I was very discouraged at first. And I'm like, well, what is the point? So I told her, I said, the point is you're going to be way more knowledgeable in what you're doing and understand what you're doing. So fast forward, there was a situation, an emergency situation, and she called me because she was so excited that she knew it. She knew what to do and she knew how to do it. And she said the manager walked by the computer screen and said, "What is that?" She said, "Oh, that's called beam hardening," like that. And she's like, "Oh," she's like, "I'm learned. That's what I'm learning, you know." And so she like that made me feel so good, you know, that I was like, I know what I'm doing and I understand what I'm doing, and I knew how to manipulate my techniques in order to get what was needed for the radiologist to read in this emergency situation. So she contacted me a few months ago, and now she is the manager of that facility.
Hell
And I'm like,
yeah.
see, that's why you don't listen. You do what you got to do for yourself and advance yourself. Because I told her at that point, you never know where life will take you. You could either make one or two choices. You can stay where you are, learn very little, or you can learn as much as you can and be more flexible and also have more job opportunities out there for you. And so she's like, yeah, that's where I'm going. I'm gonna go ahead and learn what I need to learn and get my certification.
I love like the little thread here throughout this episode of you starting with your journey into social work and having, a teacher, give you a piece of sage wisdom and maybe rechart your course a little bit. And I just love hearing you continuing that practice on and being able to have like a similar effect in the lives of your students. I think so often, like, and I say this with all due respect, I feel like when people think of online education, I think there's a gut reaction to thinking about it in terms of like, oh, you'll watch some videos and click some multiple choice questions, and then you'll get an email saying that you completed the course, right? I'm not saying that's what online education is, but I do think to some degree that's the stereotype.
There have been a lot of bad programs out there, but I'm gonna tell you
Right.
why. So I think I have the unique perspective by me being an online student myself.
Right.
So when I left and came to Arizona to be the director of online education, I saw a lot of things that could be adjusted. And it
Mm-hmm.
was at that time, the CEO of this institution was like, go at it, because I had proven that online education can work. I had all these students that was graduating not only at UAB, but across the country. So we had people across the country that was taking our courses as well. And like I said, that was one of the first programs out there of its kind. And that program grew, actually tripled in 1 year, where you had people from all over. And so fast forward, I come here, I got recruited here to Arizona and took the position here. And what happens is educators that don't have that experience as an online student, I also got my degree in curriculum and instruction online, was my focus. So I learned a lot of theology and theory of how things worked online and how people learn and how people think. And so you can use all of that. You can use the visual, the tactical, and the auditory part of it online. Actually, you can learn it, it can be better online because a student can go back and look at it again or redo the simulations again, etc. So
Mm-hmm.
it helps in a way that if an educator understands online and how online can be very beneficial, then again, that will help change that mindset. I can say though, I feel that mindset have changed a lot
Mm-hmm.
over the years with medical programs,
Right.
because now you can. I actually just did a 3D simulation for the university here, and so they can actually put they're putting their hands on the model and they're rotating the
Mm-hmm.
models and opening it up, etc. And I was kind of instructing them through it. So
Mm-hmm.
again, I am on several advisory boards as the distant education expert. And so, again, I think if we open up our minds and know that online education is not going anywhere, to be honest.
Nope.
So you need to embrace it. And when you learn to embrace it, you realize the possibilities that is there for online education. Things that you're not able to do. Like you can go inside a surgical suite, and actually perform surgery, which if you nick something on the simulation, oh well, that's fine, right? The only thing probably can hurt is your grade if it hurt that. But you're not killing a patient in the process.
Right.
So
even so much like beyond the simulations, right? Like to me, what's really standing out here is like your ability to still connect with your students even through an online program, right?
Yeah.
I feel like that is to me like the biggest piece that a stereotype would feel like the education is missing is this relationship with your actual educator. But you still have that. And I love that.
Yes. Thank you.
Okay. Chalonda, we've been talking for a minute now and we're going to start wrapping things up, but I'm just kind of curious, like what keeps you going, right? And if you were talking to a new technologist or a new educator who's kind of looking to challenge the status quo, shake things up in the way that you kind of have, any advice that you would give to them or words of wisdom?
To move forward, don't be afraid, speak up. And for new technologists, just realize that you're in a profession that saves lives. And if it wasn't for your expertise, there will be a lot of people in the healthcare that would not get the diagnosis that is needed for them to be taken care of. And so that is what I have to say is don't be afraid to advance yourself. You're not a tree. Move if you need to move and grow. It's all about growing, moving, and also take time to go out in the community and let people know about our field. We have an amazing field.
Oh, yeah.
It's actually a STEM field, and it's an amazing field. I continuously go out to the local schools and talk to the students and let them know about medical imaging. So I know we have had a campaign in our society to be seen, and we are getting out there and we're being seen more and more, and I'm loving it. And so just take pride in what you do, take pride in your profession, and realize anything is possible. So if not saying I was dreaming small because I didn't even know about the field, but when he said, when that professor said, you look like you can go into, you're basically doing well, you should check out the medical field. In my head, though, I'm like, little old me, go into medicine? And now people are like, you should have continued on and been a medical doctor. But yeah, but I love the field. It's all what you make out of it. If you are the person and you love this field, you can do wonders. You can be anywhere. You can do anything. I've written books. I've worked with the School of Medicine, done research with them because of my background and my certifications. The possibility as you learn, as you grow, the doors are open. Sometimes you have to turn some people down because it'll be that wide open for you. And so that is what I got to take away. That's the takeaway, is to make sure that you understand the power that you have in your profession and be proud of your profession.
I love that. Well, thank you so much, Chalonda. Today,
thank you.
This is once again Chalonda Jones-Thomas, educator, technologist, and the founder and CEO of the Thomas Institute of Health Professions. Chalonda, it was so nice talking to you today. Thank you so much.
Thank you, Chris. Nice talking to you.
And I'll talk to you soon.
Okay, bye-bye.
Frame by Frame Rethink Imaging is brought to you by Imalogics. Here, you'll find engaging interviews with thought leaders, experts, and patients, sharing stories that showcase the transformative power of medical imaging. To discover how Imalogics is rethinking imaging in healthcare, visit imalogics.com. Be sure to subscribe to Frame by Frame Rethink Imaging on Apple Podcasts, Spotify, or wherever you listen. And from all of us here at Imalogics, thanks for tuning in.